May I take this opportunity on behalf of Mid Yorkshire Hospital NHS Trust to thank you for considering work experience at our hospital. The work experience team are based within the Trust Headquarters and Education Centre at Pinderfields Hospital. Work experience is an opportunity for you, possibly for the first time, to see the world of work. It will also give you an opportunity to see the many careers the NHS has to offer and give you an understanding of the qualifications needed for each role. We require you to undertake the work experience placement in a mature manner. In this way, you will have the opportunity to benefit from your time with us. Please make the most of your experience. We hope that one day you may return as an employee of the NHS. Within the Trust, we provide a complete range of hospital services which we deliver from three main sites, Pinderfields, Pontefract and Dewsbury. We also deliver a number of services in the community. We have a free shuttle bus that travels to each site every half an hour. The Trust has some specialist services which include clinical haematology, neurology and plastic surgery. Mid Yorkshire is also internationally renowned for its regional burns unit and spinal injuries services. You should have now received a work experience application pack from your school or college to complete. This will include an application form, an occupational health questionnaire and a reference request form. You will need to contact your GP and request a printout of your vaccinations to attach to the occupational health questionnaire. All of these documents will need to be completed and returned together in the pack to the work experience team at least 8 weeks prior to your preferred placement date. Please ensure you add the correct dates on your application pack, and if you are unsure, please check with school or college and family to check if you have any holidays booked. Please ensure you add your correct email address on your application form, as this is how we will contact you, so please keep a check on your emails. There are many roles within the NHS, and you can look in more detail to the qualifications needed and what the role entails within the NHS careers booklets that your school, college will be able to provide you with. We also have an NHS careers website where you can look at all the careers the NHS has to offer. For example, these include physiotherapist, consultant, staff nurse, radiologists and midwives. We offer work experience within a range of departments such as radiology, physiotherapy and plastic surgery. We can now take a look into some of these areas and speak to the managers about what their placements can offer you.
Hello, I'm Sanjib Majumdar. I'm one of the plastic surgery consultants at Pinderfields Hospital, and I'm one of those people in charge of the clinical part of work experience for those of you who want to become doctors. I'd like to welcome you to the work experience program that we have set up for you at Mid Yorkshire Hospital, which includes Pinderfields, Dewsbury and sometimes Pontefract. I'm speaking to you because I understand you're interested in perhaps looking at becoming a doctor. Maybe you've made up your mind, maybe you haven't made up your mind. Either way, I'd like to welcome you to the work experience program that we have at Mid Yorkshire. Now, in the old days, when dinosaurs roamed the land, when you came to do work experience at Pinderfields, you'd end up sitting with the receptionist on the ward and being bored out of your mind. I've changed all of that. We've got a new structure of work experience, because if you come to do work experience at Pinderfields, what I want you to gain out of it is a deep insight into what it is like to be a doctor. The good bits, the bad bits, the warts and all. So the current structure has changed and evolved with time into one where you spend a lot of time shadowing different doctors. So you shadow the consultant, you shadow the registrars, the junior doctors, you spend some time with our nurses, you spend some time with our therapists, and this hopefully gives you an idea of what being a doctor is all about. Unfortunately, notwithstanding how fantastic I'm looking at to you at present, it's not all about George Clooney and ER. There's some boring bits, there's some exciting bits, all of that. Now, talking about excitement, unfortunately, we can't let you get into theatres. I know, a lot of you want to go into theatres. Unfortunately, we can't let you get in there because there's some health and safety concerns. But I'm quite happy with that, because being in theatres is quite a vicarious experience for you. And whatever you see in our theatres, you can see on the telly. What I'm interested is that you take your time and learn about doctoring from the people who are doing doctoring on the shop floor. Now, when you come to Pinderfields Hospital, you will be meeting patients, you'll be meeting staff. I've got to tell you flat out, you've got to have respect for both patients and staff at all times. If you don't show respect, I'm afraid we will have to terminate your work experience, and that'll be that. You may find you in a situation where there's a patient who comes in who you may know, might be a neighbor or an aunt or somebody else that you may know. You have to excuse yourself. You've got to respect their privacy. You have to identify yourself at all times. You've got to ensure that people know who you are and that you're a work experienced person and that they're happy that you are there. They usually are, but you've got to ask. Now, the most important part of work experience at Pinderfields is questions. You've got to ask questions, and lots of questions. At the end of your week with us, you should have answered all the questions you have in your mind about being a doctor. And if at the end of it, you decide you want to be a doctor, best of luck in your interviews, and we may be hopefully welcoming you in as a medical student or a young doctor in the future. Good luck.
Hi, my name's Karen Story. I'm a staff nurse and I work on the plastic surgery dressing clinic here at Pinderfields. This is one of the potential placements that you may come to when you come to for your work experience. Infection control is everybody's responsibility and it's a main priority, particularly within the dressing clinic. Whenever we come in contact with our patients, we need to be bare below the elbow. The reason being that obviously you don't want any of your sleeves draping into anything around the patient or on the patient. It's important that you don't wear any jewellery other than a wedding band if that's what you have, and you should be always remember to wear your protective tabard with you, and that should be clean every day. The infection policy is actually on the intranet, which you would be able to access. One of the main ways that we can actually stop infection being spread is by hand washing, and I'd like to give you a demonstration of that now. So when we come to actually wash our hands, there is usually something similar to this next door to the sink, but the other thing that you should also find about is one of these, which is this, and it's your 5 moments for hand hygiene at the point of care. So you should find these all over the wards as well, so it's a good reminder, that's all. So as regards washing your hands, you need to turn the tap on. Water obviously as hot as you need it. Wet your hands and apply the soap. Now, on the wards, they're usually the hand ones that you just put underneath and it supplies the soap. So, initially, you wash your hands together, rubbing the palms. You should then wash the back of the hands, either way. You should wash your fingertips, like this. You should interlock the fingers and get in between, but always remember it's your thumb that everybody tends to forget, and just once round the wrists each time. And then in theory, having washed, you give them a good rinse under the tap, making sure you've got all the soap off, turn your tap off and dry your hands thoroughly, because again, moisture on the hands can potentially help either chapping your hands or as a transmission for infection. Done. There are 5 main points of hygiene at the point of care. The first one is before you touch the patient at all, you should wash your hands. This actually protects the patient from you. The next one is if you were to do an aseptic technique. Now I appreciate that you won't be doing this, but you need to be aware of this, so that, again, we are protecting the patient from the person that's doing the invasive procedure, but also protecting the patient from themselves. The next one would be any exposure to bodily fluids. Remembering, of course, you shouldn't come in contact with bodily fluids, but if the need arose, you would need to make sure you'd washed your hands, and particularly after glove removal. The third one is if you actually touch the patient at all, you should have your hands. But after you've finished the contact with the patient, again, you should wash your hands. And the other thing, of course, that potentially has germs on it is this patient's surroundings. So even if you don't actually touch the patient, any of the surroundings that they have, you need to wash your hands again. One of the other ways you can keep your hands nice and clean, if your hands don't look visibly dirty, you can actually use the alcohol gel, which you will find regularly dotted around all the wards and wet placement areas. You need to rub it well into your hands each time. You can actually use the alcohol gel about 3 or 4 times, but then you must wash your hands properly. What you don't want is a build-up of gel and this thought process that you are already clean, because you never are. You need to keep regularly washing your hands. I hope this little demonstration has helped with good hand washing, and remember that infection control is everybody's responsibility.
Whilst on your placement, you need to ensure you follow our confidentiality policies. Here at Mid Yorkshire, we follow the Data Protection Act, the Common Law of Duty and the 6 Caldecott Principles. Also, please ensure you do not write anything that happens on your placement on any social media sites. On your placement, you need to ensure you respect the patient's privacy and dignity. If the curtains are drawn around a bed, please do not enter, and always knock on closed doors before entering. When on a ward, please be as quiet as possible, as not to disturb patients who may be sleeping. You will also not be allowed to read any patient notes. Your work experience placement will involve observing and shadowing members of staff. You may be asked to help with such tasks as helping make drinks or chat to patients to make them feel more comfortable, taking part in group discussions, making unoccupied beds, and helping ward assistants with admin tasks. With a patient's permission, you may be able to observe such things as blood pressures being taken, blood tests, etc. But please do not be offended if the patient says no. The trust criteria to undertake a placement is that you need to be 16 to 19 years of age to be placed on a clinical ward. If you have not had both MMR vaccines, unfortunately, we will not be able to offer you a placement on a clinical area. We do allow students who are aged 15 to undertake an administration placement. We can only offer 1 placement per student due to such high demand. If you have a family member who works for the trust, we are unable to place you in the same ward or department. Hospitals are very conservative, so when you arrive for your placement, please ensure you follow these guidelines. No denim, no miniskirts, no short tops which expose the midriff, no low tops, no shorts, and full shoes must be worn. If you wish to wear makeup, then it needs to be tasteful. There are some areas that we are unable to offer a placement. These include the labour ward, operating theatres, intensive care, pathology and A&E at Pinderfields and Dewsbury, as these are classed as traumas, which are unsuitable for a work experience. We can, however, offer a placement in A&E at Pontefract. It is also essential that you do not visit any of these departments whilst on your placement. Please remember that you are in a hospital environment and it can be very unpredictable with regards to patients' illnesses. You may come across incidents that you may find upsetting. If you are wanting to come into this occupation, you need to be prepared for these kinds of events. Once we have your placement organised, we will email you along with your school and college. We will attach a confirmation letter. Please read this carefully as it will confirm the date and time of your placement, along with your honorary contract that you must sign and return a copy to the work experience team prior to your placement. Please acknowledge receipt of these documents. This is to let us know that you have received the information and that you intend to take the placement offered. You must have the correct attitude and behaviour. If we are informed of any behaviour concerns, your placement will be terminated and your school college will be informed. The Trust also operates a no smoking policy, so if you do smoke, you need to ensure you leave the hospital grounds. You are asked not to attend your placement if you are suffering from anything infectious, such as cough, colds or diarrhoea and sickness. Please inform the work experience team if you are unable to attend due to illness. On the morning of your placement, you will need to arrive in the Trust Headquarters and Education Centre to collect your work experience pack, your ID badge and also your tabard. We do require a £10 deposit to cover the loss of your ID badge and tabard. You will receive this pack on your last day when you return your pack. In your pack, you will have an induction checklist which your mentor will complete with you on your first day, a daily log, a signing in and out sheet which you need to complete on the ward or the department. Please ensure you complete this as the ward manager will need to account for you in the event of a fire, an evaluation form and also the work experience team's contact numbers should you need to contact us whilst on your placement. On your last day, which is usually a Friday, you will return to the Trust Headquarters and Education Centre for 12 p.m. and return your pack and collect your deposit back.
I hope your work experience will help you focus your career hopes and give you a clear understanding of the academic requirements needed for your chosen profession. Good luck.